CTEPH, Dr. Madani, take one.
Hi, I'm Michael Madani, a cardiothoracic surgeon at UC San Diego Health, and I specialize in PTE surgery. I'm here to answer your questions about PTE surgery. What does PTE stand for? Well, PTE is short for Pulmonary Thromboendarterectomy. And in European countries and other parts of the world, it may be referred to as PEA surgery, which is pulmonary endarterectomy surgery. How is PTE surgery performed? Imagine you have a scar anywhere in the body and then you want that scar removed. You can't just go pick at it. You actually have to gently remove a layer of skin with it. So that's what we're doing inside the vessels of the lungs. We have to gently remove the inner lining of the arteries where these scar tissues are. In order for us to be able to do that, just like any other heart surgery, we have to go through the middle. We have to get the patients on the heart-lung machine so we can divert the blood from the heart and lungs. And then we cool the patients. We cool them actually quite a bit. That will allow us to drain the blood off the field and actually have a really bloodless field where I can see, or where the surgeon can see, deep inside these tiny arteries and determine what is scar and what is normal wall and gently remove all the scar tissue. And once we're done with one side, let's say the right side, we do the same thing on the left side. And then after that, we start to warm the patient back up. As far as the patient is concerned, it really is just like any other form of open heart surgery in terms of what they go through and recovery, except the difference is quite dramatic when they wake up and feel the difference in how they can breathe. Who is eligible for PTE surgery? The eligibility is really if they have the condition and the scar tissue or the old clots, and we call them clots, but they're obviously scar tissue, old chronic clots, are accessible by surgery. In our hands, we can actually get really, really far. And that's one thing that sets UC San Diego Health apart, because we can get really far in the small vessels of the lung to remove the scar tissue. So if somebody has evidence of what we call surgically accessible clots and they have symptoms related to that and they have pulmonary hypertension, they will be eligible for surgery unless they have other significant conditions that may prevent them from having any heart surgery. What can a patient expect during the recovery process after PTE surgery? Once the surgery is done and they're in the ICU, typically they stay longer on the ventilator, and typically by next day, we'll be able to wake him up and get the breathing tube out. They'll have a couple of drainage tubes that remain around the heart and sometimes around the lungs for drainage of fluid. Those typically stay a few days. They typically stay in the ICU an extra day after the breathing tube comes out, because we want to really closely monitor the function of the lungs, oxygenation, and afterwards they get transferred to step down on regular floor. What kind of improvement can patients expect? Almost immediate relief of that high pressure in the lungs and actually being able to breathe freely. It's very dramatic. And as a surgeon, it is so gratifying to be able to do this operation. And literally, once the breathing tube comes out, the patient says, "Doc, I can breathe again. I can feel it again already." Sometimes in regular cardiac surgery, we don't see that. And that's really gratifying.